Well, UF Health is here now to talk about aortic valve stenosis. I cannot wait to learn more. It seems very fascinating. We've been talking with them off camera. So let's welcome Dr. Calvin Choi and Dr. Errol Belli. Thank you so much for joining us today.
Thanks for having us.
Yeah. So what exactly is aortic valve stenosis?
So aortic valve stenosis, aortic valve is the main outlet valve of the heart. So that's where the heart pumps blood, goes through the aortic valve, and that's how the blood circulates through the rest of the body.
And is stenosis something different than that, like an issue, or is that actually what it's just called?
It's what it's called. You know, we talk about valve function. Sometimes the valve can get too tight and blood can't get through. That's stenosis, and then or the valve can leak and it can come back, and we call that regurgitation. So aortic valve stenosis is actually just a failure of the aortic valve that happens to a lot of the people as we age.
And now, are there symptoms?
Yes, so there are a lot of symptoms folks can experience. The most common symptoms are shortness of breath, chest pain, profound fatigue, and if it's bad enough, folks can even pass out from it.
Oh, wow. So how do you treat it then?
So we have several options. We usually, you go and see your cardiologist who will identify the problem. He'll usually refer you maybe to a surgeon like myself.
Okay.
And we do a heart team approach to your care. So we'll make a shared decision on what's best, because it's a very complex way, and there's a lot of options to treat it. And what we brought today, and Dr. Choi will probably show you, is the least invasive method for treating transcatheter aortic valve replacement.
Okay, yeah, explain that for me.
So traditionally, if you just go back a decade or so, only way we could replace the heart valve is through an open heart surgery.
Right.
Going on a bypass machine. Fortunately, we have a newer technology. It's called TAVR, and essentially these are the examples of the valves that we use. They come in different shapes and sizes.
Wow.
And this is the catheter actually that we use.
Okay.
These are steerable, meaning they can change in direction.
Weird.
So,
that's so cool.
This is fairly small size compared to the artery most patients have.
Yeah, I was thinking this looks pretty thick. It made me a little nervous, but you're actually saying the artery is bigger than this.
Much
okay,
bigger than
well,
this.
good to know.
So this is a way we can deliver the
really
heart
neat.
valve and replace the heart valve.
And so how do you, I guess it just depends on the patient, right? Whether you choose the transcatheter or surgery, because that's still an option, obviously. It's just more invasive.
Correct. Yeah, there's many reasons, and it's a complex thing that you probably will go through with your surgeon. But maybe for younger patients that we need the valves to last longer. Someone in their 30s or early 40s, maybe this isn't the best option, because we need to have that valve last a long time. So then that's when surgery comes in, and we have options of auto transplanting your own valves or using mechanical valves. But that's why it's important to kind of talk with both your cardiologist and your surgeon to get a full range of options for you.
And how long do they typically last, the valves?
They tend to last about 10 years, give or take. So they're on par with surgical valves.
Right. Well, if somebody is experiencing some of those symptoms, or they're just concerned about their heart in general, what would you tell them to do? Come see you.
Yep, come see us. Give us a call, and we're easy to find. So come see us, and we can run a battery of tests to find out what the problem is and identify the cause of the symptoms, and hopefully define a treatment plan.
Yeah, sounds like a good team. Yep. Good team of doctors here. Well, thank you so much, both of you, for joining me today, and thank you for what you do, keeping us healthy, keeping us safe.
Okay.